Charaka so beautifully says, a man who knows one Shastra and that to one part of the Shastra, he is not a doctor, he is not fit to be a doctor, he is a businessman. You must know the whole Shastra, and the holistic medicine is coming back. And we have been able to get WPH as the future of healthcare by the IOM, whole person healing. Where, can you believe an 85-year-old lady was done an angioplasty, and that's the lady who died in that village? A 4-year-old child was replaced, a valve, and the child dies in the hospital itself. It is like in the olden days, everybody's kannella tegiyudu, cataract. It has come to that now. ಅವಾಗ ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ರು, ಈಗ ಹಾರ್ಟ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡ್ತಾರೆ, ಹಾರ್ಟ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ವಾಜಪೇಯಿ ಮನೆಯಿಂದ. And cancer area still works. They are hoarded up, taken to one place for Vajpayee thing, and then all their tube stuck here, another fellow tube stuck there, and they are in a bus. They are taken to the other place, and then they are taken back because the money comes from the Vajpayee scheme. So that's what I told Nadda. Don't spend your money on sickness care. Spend your money on health care. This country will be a healthy place. Not a penny is spent, because healthcare is not under, say, PWD is not under the health minister. I think health ministry must be PWD ministry. You'll be fine. Agriculture ministry is not under the health minister. It should be there. So we have this reductionist idea in every field. You must have a holistic idea. And don't you look at the human body in bits and pieces. Charaka so beautifully says, a man who knows one Shastra and that to one part of the Shastra, he is not a doctor, he is not fit to be a doctor, he is a businessman. You must know the whole Shastra, and the holistic medicine is coming back. And we have been able to get WPH as the future of healthcare by the IOM, whole person healing. Where person is energy. Today, quantum physics says your body is your mind is your body, and the energy displacement is disease, and replacing the energy is medicine. And we are working on that, and we have so many devices, heart attack patients, stroke patients, and now we have even got for various psychological diseases. You know, the biggest problem in psychological diseases, we are treating the brain, but the mind is not in the brain. This is the problem. The mind is not in the brain. Brain is only a coordinating structure. It's a very small structure. Mind is a huge thing. You can't confine the mind to a brain. And there is this neuroscientist in Mayo Clinic. His name is David Weber. David is the emeritus professor of neurology in the Mayo Clinic Medical School. And David has done a beautiful book. I want all doctors to read that. The book is called The Theory of Reality. Reality. Your consciousness, and what you need is placebo therapy. Do you know what happens when you take medicines? You don't know. Study this. The study is called Mitochondria as Chi. Chi is energy. And this is written by a professor of genetics in the journal called Genetics in the year 2008. It's called Mitochondria as Chi. Madam is writing. His name is Douglas Wallace, madam. D.C. Wallace. Author's name. Article's name is Mitochondria as Chi. Journal is Genetics. Year is 2008. Volume is 179. Page is 727. Go and read it. Free. Why I'm telling you this? He had a chip, MIT chip, mitochondrial chip. You take any medicine, reductionist medicine, and chip it, tag it. As soon as it goes to the stomach, the body's wisdom, consciousness says, this is something I have not seen. My ancestors have not seen. So it must be poison. Send it to the liver. It goes to the liver for destruction. And sometimes something remains, it comes out. It's called the first pass effect. Pharmacology professor has taught you first pass effect. But he has not told you what is the philosophy of first pass effect. That means any drug that you take today, it destroys your liver. You know, when I was a student, there was nothing called non-alcoholic cirrhosis. Today, non-alcoholic cirrhosis is the biggest disease in the world. Would you know that? And it's all because of drugs. And what happens when? What comes out is the one that gives you side effects. But what has gone in has destroyed the liver. So no chemical drug which goes inside works. But the same thing given as a whole, like for example, a tomato you take every day, which contains 25 milligrams of vitamin C, it will prevent the onset of cancer in the next 5 years, 5% less. You take vitamin C every day, your chance of getting cancer goes up by 5% inside it. Did you know that? This is called hormesis, not taught in pharmacology in the medical school. Hormesis. Now, this is why I'm saying you are not wrong. You are all nice young boys and girls who have come out of the medical school. And Shankar was saying, sir, they have spent so much of money to go in the medical school and become doctors. So, you tell them not to make money, they'll feel bad. I said, Shankar, you're right. But I never learned medicine as a business to make money. I went to the medical school to be of some use to society. Of course, I didn't spend money. I spent only 230 rupees a year, my school fees. That does not mean I shall not make money and you make money at the patient's cost. No, 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 no. This is not a business. So, friends, TIE is a right opportunity for you. Deliberate on all these things. I've written extensively about it. 30 minutes is up, and I'm going to stop. And they say I have 15 minutes for you to ask questions. Questions welcome, answers not guaranteed. Thank you very much.